I am going to ask Mary Ann to go ahead and call roll, though.
Shelley.
Here.
Juliette Brown. Susan Birchfield. Here. Mary Ann Contreras. I'm here. Wayne Dennis. Linda Galvan. Eric Heathley. Jennifer Northway. Ram Perez. Kara Tapley. Paula Yuma. Okay.
Okay, hopefully some of our committee members will be joining us.
Before you guys get too far, can we ask you to move positions so you are in front of the microphones? The acoustics in this room are terrible. So if you're not right on top of the mic, we can't hear anything you're saying.
Thank you. Thanks. Okay, thank you. We will dispense with approving the minutes since obviously we do not have a quorum. I do want to say that there are some members of our committee that are going off the committee, so I actually have certificates for them. Juliette Brown, who had joined the committee last year, has taken another job and moved in July, and so by virtue of relocating is no longer on the committee, so I'll make sure that she gets her certificate sent to her. Eric he did send me an email and say that he is caught in traffic on I-35. He's headed this way, and so hopefully he will actually be able to show up before our meeting ends. And then finally, Paula Yuma, and Paula, how long have you been on the committee now? Several years. So hopefully Paula will reapply for the committee when it opens again in September of 2013. But Paula, if you'd come forward. And I do want to mention that, as you all know, membership for the different committees opens in September. I believe it opens at September 1 and goes through September 30th. That's really the only time you can apply. There will be applications online at the GTAC website. So if anyone is interested in being a member of the Injury Prevention Committee, we would encourage you to apply. The other thing is that, and if you know of anyone that might be interested, we're also looking to have a good geographic distribution of folks on the committee. So particularly we'll be looking for people outside of the Austin and Dallas areas. So if anyone knows of people who might be interested in serving on the committee, please just make a note that either let me know or ask them to go online at the GTAC website in September. Having said that, we will have 3 new members joining our committee in 2013. Debbie Nichols is here. Debbie, you want to just raise your hand back there? Thank you. Debbie from Fort Worth. Stuart Williams from the Austin area, and Courtney Edwards from the Dallas area. And I don't know if Courtney's in the room or not, but we welcome them to the GTAC Injury Prevention Committee. I've asked Paula to give a presentation today. This is a presentation that Paula originally developed for a TTAF symposium a couple of years ago, I believe. And it was so well received that she was asked to also do this as part of a webinar series that the Safe States Alliance and the South by Southwest Regional Injury Prevention Network put together. So it's actually archived online at the Safe States Alliance website, which is at www.safestates.org. But I've asked Paula to give it again in person here at the Injury Prevention Committee meeting. And it's an excellent presentation. We talk a lot about, and you probably heard us talking about, evidence-based and evidence-formed strategies. And at one point we decided that, maybe we throw these terms around all the time, and maybe not everyone knows where to actually find evidence-formed, informed, or evidence-based strategies. So Paul has put together an excellent presentation on, just the process you go through in trying to find this information, and also what to do when there is not a good evidence base out there. So Paula, I'm going to let you go ahead and get started.
Thanks so much, Shelley. She's really sweet. My name is Paula Yuma. I manage plagues in Europe, plague doctors, what they were called. And they used to wear those bird masks and stuff them with things that smelled really good. So they would have orange peels and cinnamon and freshly cut hay in their mask because they believed that plague was transmitted by smell. And if they weren't able to smell those bad smells, they would get plague. Well, almost all of the plague doctors died, right? So that was one time where it led to very poor consequences. Certainly you won't be facing consequences of that. Right? But another example, who here has heard of the DARE program? Okay, so the DARE program started in the 1980s and was in place in public schools in the U.S. for about 20 years. And it was found to be completely ineffective. It wasn't built on a good evidence base, and eventually the federal government pulled all funding for programs that are not evidence-based. So the DARE program lost its funding. These are both examples of how people in prominent positions can convince others that something is worth doing. So the DARE program evolved from an interview that Nancy Brady did. When they asked her what should be done about the youth drug problem, she said children should just say no. And the DARE program was formed around that idea. They could just say no to drugs and alcohol. And then it proved to be completely ineffective because it wasn't built on the evidence base that existed. All right, so evidence-based practice is basically a bridge between the ivory tower of scientific researchers and people doing, the heavy lifting in the community. So it works best when it's sort of a two-way street. And people who are doing practice can communicate with those who are doing research. People who are doing research can communicate what they're finding to people actually in practice. All right, so just because you want to use the evidence-based practice process, don't feel intimidated. You don't have to be Einstein for this to work. You also don't have to be a magician to make this work, but it will make you seem magical and smart, which will be much more effective than you have been in the past. Okay, so we're basically just going to go over these 5 steps today. And they're pretty simple. They sort of align with the scientific method. So first, we want to formulate a question that has to do with an issue you'd like to address in your community. Then we do a search for evidence. And the more systematic our search can be, the better it will be. Then we want to critically appraise what we find. So you never want to take what you find in scientific literature for granted. And we'll talk about how to appraise it. And then you're going to want to pick out a strategy. Pick out a strategy or program and implement it in your community. And then you want to see if it's actually working for you. Okay? So you can evaluate the outcome. All right, so the first step is asking questions. And we can ask questions about lots of different aspects of our work. Very often, our questions are going to concern interventions. What are the most effective interventions for drug trafficking? What are the most effective interventions for child pedestrian safety or car seat safety? Those types of questions. But it can also concern implementation, like what's the best way to implement a program in a certain type of community. And it can also concern assessment tools, which is if we were doing a needs assessment, what's the best way to go about that. Do you have a question? You guys feel free to jump in if you have questions. Sorry. You're just listening so attentively. So we're going to use an example question today just to go through the process. And our question is going to be, what strategies are the most effective for preventing underage drinking in Austin, Texas? All right, so there's 2 different ways we can search for the evidence. We can do what's called a bottom-up search, where you go to the literature, you go to a database like PubMed or Social Sciences Abstracts, something like that. You do a search, and you pull in all these articles, and you review the articles and try to find an intervention that works for you. This is very time-consuming. And for some topics, this is going to be direct fit, but for a lot of the things we address in injury prevention, someone's already done that work for us. So we can do what's called a top-down search. And we review on the work of others who have already conducted systematic reviews. And that's a strategy I recommend if there's a systematic review that exists for your topic. starting to search for a review if you're doing top-down search. So you go to these websites, they're all free and available to the public. Search for your topic and see if a systematic review of the literature is already manufactured. And save yourself some time. There's also some systematic reviews available from the CDC, the Guidance to Community and Clinical Human Services, and a Harvard Review, which is a university up in Seattle, a university hospital system. These other agencies also provide you with systematic reviews. Now, using Google and Google Scholar can be kind of dangerous, right, or whatever search engine you use. So you want to look for resources with website links that are .edu or .gov, right? So don't just trust anything that you find. You really need to carefully evaluate .org resources to be sure that they're not biased in some way. Okay, so in our search for evidence, we're going to do just a Google search of strategies for prevention of underage drinking, right, to help answer our evidence-based practice question. So we got a ton of responses, but I saw that one of the responses was from a really trusted government agency, the NIH, the National Institute on Alcoholism and Alcohol Abuse. It's kind of a long report on prevention strategies with minors, so I selected that as my resource. And this is the website where it's available. So we found some evidence, and now we need to critically appraise that evidence. We need to decide, is this something that I can really base effort and time and money on, or do I need to do some more searching, or do I need to do some research of my own? So what we want to do is ask kind of these basic questions about research studies. Were the outcomes measured in a reliable and valid manner? Was the research design strong enough to indicate that the intervention itself was the cause of the outcome, or could the outcome be due to some other factors, right? Changes in society or public opinion, other interventions that were taking place at the same time. What did they do to be sure that their intervention was causing change? And then if we're using a review, as we are in this case, we want to know what were the inclusion criteria for the review? Did they only include studies of a certain caliber? Did they review anything and everything? What were their inclusion criteria? Were they strong enough that we feel confident that was a good review? And how did they evaluate studies? Some of these reviews just look at how phenomena are measured. They don't look at outcomes. So we want to know what actually did they evaluate about the studies. And if you need help, feel free to contact people at your local universities, members of this committee, other experts that you have access to. Usually, I know the professors that I work with at UT would be thrilled to help members of the community with this. So just reach out and ask for help if you need it. So when we're critically appraising study design, I don't want to get too far into this. There's entire classes on study design. But I just want to point out that there is the studies at the top of this pyramid, studies that have a case and a control group, so studies with a comparison group, are those that we kind of feel more confident or ruling out alternative explanations for change. So whenever possible, you want to use a study that has what's called a quasi-experimental design, which means there's comparable groups. One group's getting the intervention, one group is the control group, or that has randomly assigned groups. So from the sample, people are randomly assigned to the intervention or the control group. Okay, so these are our strongest studies. Systematic reviews, really good ones of topics that have a lot of research around them, will typically only include those types of studies. Now, if it's a newer topic or there's not that much information about the topic, the reviews you're looking at or the individual studies you're looking at may be from lower on the pyramid. These aren't necessarily bad studies, you just have to be a little more skeptical about the results. Okay, so now we're going to critically appraise our evidence, right? We're going to look at that report that we downloaded from the NIAAA. involving parents in monitoring and communication, highly interactive education strategies, and being sure that the interventions that had been proven to be effective were implemented with fidelity, which is implemented in the way that they were studied. No. Okay. Not too bad. All right, these studies also identified tactics that didn't work. Scare tactics were not effective. Bringing high-risk students together or making an example of high-risk students was not effective. Only focusing on information and not actual skill building was not effective. And then failure to focus on alcohol and tie in norms and skills were also ineffective, right? So now we have some strategies in our toolkit that we know might be effective and know might work in our community. So we're going to select those strategies based on what we know about our target population, based on our resources to implement the strategies. We don't have to do anything and everything that was identified to be effective, but we're going to do everything we can based on what we found. Okay, so we want to consider again the quality of the evidence that remains prevalent through the whole process. But if we have some interventions with, a dozen studies backing them up, and then we have one intervention with one study backing it up, we might pick one with more evidence and more communities that work. We also want to know if the intervention has been studied with a population that's similar to ours. So those of you working in rural communities, you might look to see if the intervention was tested in a rural community. Those of you kind of minority communities or Spanish communities might look for the same in those studies. Even evidence-based interventions are not effective with every population. And when I teach this to my class, I use the example of my daughter. I helped do a systematic review and draft the state's position statement on safe sleeping for infants. And where did my baby go to sleep? Me in my bed, which resulted in me just not sleeping for, 6 to 8 months. And I did make sure that she slept safely, but it really created a very difficult situation for me because my baby didn't care about the evidence base that said that she needed to sleep for it. So even those evidence-based interventions won't work with every population, which is why we need to always evaluate and make sure it's working with our own population. Okay, so now we're going to go back to our example and select an implement strategy, right? So I think that the best strategy, based on those reviews and based on the resources that I have, is working to limit youth access to alcohol, okay? So I've got to do that through 2 channels. I've got to do that through sales channels, and I have to do that through adults providing alcohol to kids, right? So my interventions have to work with a broad coalition of people. We can't just do this on my own. So we've got to work with law enforcement, we have to work with retailers, we have to work with community leaders, and we have to work with parents. The second strategy I want to implement is working to change norms in my community. Kids growing up in my community shouldn't just believe that it's normal to take a drink alcohol, right? A, we know it's not, it's statistics. And B, that's very dangerous beliefs. We need to change that norm. And so we're going to partner with media and student thought leaders in order to do that. All right, so now we have to see, did these strategies actually make a difference in my community or not? Do I need to do something else? So evaluation is a really essential piece of the process. And you shouldn't be scared of evaluation. Everyone, I think, comes into having to look at evaluation as it's too hard, it's too expensive, it's too time-consuming. I believe it worked. I feel that it worked. I got good feedback from the teachers and students. Right? That's not enough. We've got to do a little bit more than that. So we have to be, ideally we include injury outcomes in our evaluation. But this isn't always possible, especially if the issue that you're working on occurs rarely. It can be very difficult to use injury outcomes. So if you know that there's an intersection in your community that's very dangerous, you've done some observations and you've repeatedly new misses occurring. For instance, maybe an injury outcome isn't the best, right? Because even if you just had one or two incidents there a year, it's still a really big problem in your community. What you might do is repeated observations, so those near misses are going down, might not necessarily be an injury outcome. So some other outcomes that you might measure: participation for one, and I think we usually do a pretty good job of measuring participation. But back to our example, we're going to maybe study how many youth are able to purchase alcohol at a retail location, whether existing laws are being enforced on a regular basis. We could look at citation records and arrest records to see if that's happening. We can look for the passage of new policies that help prevent youth access to alcohol. We can measure parental monitoring, and we can go back to the research and find existing tools to do that. And we don't have to create new tools, and in fact you don't want to, because very often those tools won't measure what you're hoping they will. If you use an existing tool that's already been evaluated, it may be more successful. We can track what happens in the media, what kind of audience we're reaching. We can do surveys to see if the perceptions of norms related to drinking have changed. And we can look at emergency room admissions related to alcohol and see if they've decreased. Now, we often run into situations where there isn't the evidence base that we'd like to see. So with alcohol, there's a huge evidence base. There's multiple journals dedicated to alcohol research. There's multiple federal and state agencies dedicated to alcohol. There's other issues where we don't have much evidence. And one that's a big one for us in Texas is ATV injuries, and especially child ATV injuries, right? Very concerned about that. We've seen huge spikes in it in our trauma registries. So it's an area that really needs some prevention help. But there's no reviews, there's no randomized controlled trials, there's no studies at the top of the pyramid that talk about how to prevent child ATV injuries. Right? The studies that do exist are survey studies, focus group studies, that sort of identify potential prevention ideas, but they don't actually test those prevention strategies. And then we know that there's some legislative strategies that have been evaluated that are effective. So there's some policy changes, restrictions around rider age, helmet use, training courses, vehicle size, and whether or not for us we can enforce those laws on private property where most of ATV injuries occur, or some legislative changes that we know might be effective. So this is all we have to go on. So when this is the case, so that we cannot just say, oh well, I'm going to go on vacation, right, which is what I would like to do. But we have to stay and work. So we basically build on what is known. So we might look at some epidemiology studies, or you might do a study of your own trauma registry data and see who's being injured, how are they being injured, and identify some opportunities for prevention there. And even though those studies that we have in our surveys and focus group studies, they still point us in a direction, right? So we still want to build on them. We don't have to recreate what they've done. And then what I might do in this case is call somebody who's doing that research. So in this case, Mary Aiken, a pediatrician in Little Rock, Arkansas, is the leading researcher of child ATV injuries. I might pick up the phone and call her, let her know what my situation is. She'll be very happy to hear from you. Do you guys know that the average readership of a published academic article is 9 people? All that work, and maybe, and that's the average. So like half of them are below that number, right? So they will be thrilled if you call them. They'll be so excited to hear from one of 9 people who read your article. All fun. And that's the sort of ideas on their research. And then you want to continue to evaluate the results of the intervention you do implement. So you may be able to contribute to the body of literature just by contributing your own results to the literature. And it seems like an intimidating process, which really is not, especially if you partner with university partners in your area. discussion.
Any questions for Paula? And if you have a question, please come to the mic.
Oh, yes, it's on that. Go ahead.
Sure. It's this is actually one of three webinars in the series. So it's available at www.safestates.org. And if you get to that, then you the tab that you need to click on is training. And then from there, that it kind of leads you to which of the webinars. And as I said, this is one of three. So it's the first series, the first webinar in the series. The second webinar was on. So now you found the evidence. So how do you implement with fidelity? And it's a lot about, and this is going to sound like a complicated term, but implementation science. It's really not that complicated of a presentation, and like Paula's presentation, it was conducted by Lindsay Myers with the Colorado Department of Health. Very good information with lots of resources on it. And then the third webinar in that series was, okay, so where do you find, I mean, what do you do if there is no evidence behind your issue, such as Paula alluded to in this? And that was conducted by Dr. Kimberly Ferrer at the Centers for Disease Control. And she talked a lot about violence prevention strategies. Paula mentioned that ATV injuries are an area where we don't have a lot of evidence yet, but we also don't have a lot of evidence behind some of the child abuse prevention and domestic violence and things like that. And so there are some real challenges in determining strategies to implement. So that was the third webinar in that series. Any other questions or?
I would love to take some questions.
Well, if not, we won't. We will move on to the next agenda item. So thank you very much, Paula. The next thing on the agenda is a discussion about the spectrum of prevention fact sheets. And those of you who have attended the Injury Prevention Committee meetings for the last year have probably heard us as a committee talk about the spectrum of prevention. It's a tool that was developed by the Prevention Institute, which is a nonprofit organization out of Oakland, California. One of the things that the group, our committee, decided to undertake at one of our workday meetings this summer was developing a spectrum of prevention fact sheet on some of the leading causes of injury death in Texas. So each of the committee members have taken a stab at working on these fact sheets. They still are very much in draft form. I brought copies of some of them that the committee members here at the table have. We have done a fact sheet on concussions, one on child passenger safety, one on alcohol-related crashes, one on teen driving, one on, trying to think, what was the other one you did? Older adult falls. Those are the ones that we have at the table with us today. Our committee members have also developed fact sheets, and we just haven't had a chance to go through them in a detailed and systematic manner yet. But Kara developed one on pedestrian safety. Susan developed two, one on drowning prevention and one on outdoor recreational safety. And then Linda Galvan has developed two, one on child abuse prevention and one on domestic violence. And I think what we're going to do as a committee is probably during 2013, we'll continue to review until we feel like that they're in good enough shape to make available on the GTAC Injury Prevention website. As Paula mentioned, one of the criteria for developing these spectrum of prevention fact sheets were that we only utilize reputable sources, either government agencies or sources that have taken the time to evaluate, and so we're only including evidence-based or evidence-informed strategies and suggestion in the spectrum of prevention. And just as a reminder, the spectrum is a 6-level tool that looks at changing policies and laws. The 5th level is changing organizational practices. The 4th level is fostering coalitions and networks. 3rd level is educating providers. The 2nd level is promoting community education. And the 6th level is educating and enhancing individual knowledge and skills. And so the idea behind the spectrum of prevention is that you develop strategies in each of those levels. You don't pick out one of them and focus only on one strategy, but to do a comprehensive program, you're actually implementing strategies in all 6 levels. Do any of the committee members have anything to add regarding our work so far on the spectrum? Okay. If not, typically our committee, because there is a lot of work to be done, and we can't always get it done in the hour-and-a-half time period that we have for the regularly scheduled quarterly meetings, we typically will schedule some workday meetings throughout the year. Last year, I think we met twice. We typically schedule 4. If we don't need to meet, the meeting gets canceled. But I would like to go ahead and try and schedule the 2013 workday meetings, and so that we have them on the calendar if we need them. Typically, what we've done in the past is tried to meet the month before the regularly scheduled GTAC meeting, so that means that we would meet in January, April, July, and October. And at the last couple of years, we have tried to schedule them so that they're not all in Austin, so we've tried to make them, if we've got people coming from different parts of the state, we've tried to schedule them in different parts of different cities. So I'd like to look at that. Typically, we've looked at the last Friday of the month, which is January, April, July, and October. Thank you, Marianne. Does the last Friday still work for committee members? Okay. That would be January 25th, April 26th, July 26th, and October 25th. And again, these, because these do conform to the Open Meetings Act, these are open to the general public as well, and agendas are posted on for these meetings, as well as our regular meetings, agendas are posted on the GTAC website 6 weeks prior to the meeting. So January 25th, do we want to meet in Austin? Do we want to meet somewhere else, or any of the committee members?
We'd be happy to host it in Fort Worth too, if you want.
Okay. Why don't we say January 25th will be Fort Worth? Okay. April 26th?
I stand open in Temple at all times, but I know that's not real conducive.
Are there hotels in Temple, Susan?
We have plenty of hotels
then why don't
in
we
Temple, and we even have an airport in Temple.
Why don't we do April 26th in Temple? Let's look at July 26th in Austin. And then, Kara, what about
That'd be great.
October 25th in Tyler?
Wonderful.
Okay.
Just in time for the half marathon.
Okay. Okay. At this time, I'd like to open it up for public comment. Does anyone in the audience have any comments? Yes, please. Please come to the microphone.
Hello.
Hi.
Good afternoon. My name is Carol Smith. I was invited here by Susan Birchfield to speak with y'all this afternoon about ATV safety. So thank you very much, Ms. Yuma, for the introduction. Again, my name is Carol Smith. I'm here with my husband, Nick. He's part of a group that we work directly with the Texas 4-H ATV Safety and OHV Education Program. I'm their state coordinator through Texas A&M University. Most states in the U.S. have a good amount of public land on which to ride four-wheelers or ATVs and all types of off-highway vehicles or OHVs. Texas doesn't. Our lands are 97% privately owned. The need for public education for keeping children and adults safe on ATVs is imperative because while our state has more ATVs than any other, most families are riding them on private land. We do have excellent laws for the use of ATVs on public lands, although there's no laws of which can impose fines or penalties for the improper use of ATVs or the lack of the most basic of safety initiatives, such as wearing safety gear on private land. My program started about 3 years ago, and we've had a wonderful success rate for getting the ATV OHV safety awareness message to the children of our state. Our biggest issues are children who ride without a helmet, ride with more than one person on the ATV, and ride an ATV that is too large for their age or their size. Nationally, riders 16 and under represent a quarter of all those killed or injured on ATVs. From the years 2000 to 2007, which is the latest research information I have, an estimated 5,027 people died in ATV-related crashes. Of those, 23% were under the age of 16. During the same period, an estimated 1,012,000 people were treated in hospital emergency rooms for ATV-related injuries, and of those, 30%, that's 306,400 children were under the age of 16. Children under the age of 16 account for 14% of ATV riders nationally, but they're 37% of the ATV-related injuries and 28% of all ATV-related fatalities. Nearly 90% of the children under the age of 16 who were on ATVs were riding an adult-sized ATV, and less than 4% of those ATV-related injury victims received any form of formal training. In 2007, only 18 states had formal education standards for ATV operators. As a state-licensed ATV Safety Institute rider course instructor for the past 10 years, I believe that there is no better way to teach a youngster to be safe on an ATV rather than a 4-hour hands-on ride the ATV rider course. The ASI is trying everything they can to get people to take this rider course, especially children. They have a cost reduction for children, and that's a big incentive. And through my program, I have been able to train many kids, the 4-H children, at no cost, thanks to the ATV Safety Institute. Barring taking this rider course, I have found that bringing an ATV safety awareness message is the next best thing. This safety awareness message can be taught in as little as 20 minutes or up to 40 minutes. In my program, I utilize the ATV Safety Institute's golden rules. I have safety videos. I do a tread lightly message, which is outdoor ethics. All of this is in a PowerPoint presentation. I also distribute posters, stickers, coloring and activity books, and I have an interactive computer CD game that teaches ATV safety. In the past 2 years, I've been able to bring this message to over 10,000 Texas school children in more than 43 counties in my state. Working mainly within the 4-H framework of county extension agents, I presented at Progressive Agriculture Safety Days, health fairs, school assemblies, 4-H clubs, off-road clubs, anywhere I can get a captive audience. Generally speaking, I get to 15 to 375 people, age 8 and up, at a time. In order to spread the message even further, I'm currently partnering with the Texas Department of State Health Services, Scott and White Trauma Centers, Texas Parks and Wildlife Department's hunter safety educators to have more adult volunteers take my safety awareness training. This is a train the trainers course. I've developed this curriculum for teaching these trainers, which includes all the materials they need to present, as well as pre and post test questions to make sure that the knowledge is being learned and retained. We are also working to identify the counties that have the highest accident injury rates and targeting them with public service announcements in radio and TV markets, as well as having those safety awareness trainings in that area. The program is funded by Texas Parks and Wildlife Department, Yamaha Motor Corporation, Tucker Rocky ATV Accessory Distributors, and my administration is done by Texas 4-H. My media materials are supplied by the ATV Safety Institute, Tread Lightly, and the National Off-Highway Vehicle Conservation Council, of which I am the Texas State Representative. I do print some of my own brochures and posters and my training curriculum booklets. My youth model ATVs have been supplied by Polaris Industries, El Campo Cycle Sales, and my adult model ATVs by El Campo and Alamo Cycleplex in San Antonio. I utilize these ATVs during my safety awareness presentations as well for static demonstration, many of which are supplied by local dealerships that are members of the Texas Motorcycle Dealers Association. According to the National Institutes of Health, the accident injury rate for Texas school children on ATVs has declined in the past 3 years, and I'd really like to think that my program had something to do with that. The children I see are very receptive and open to the message I bring, and in true 4-H tradition, many times they take that message back to their parents, and that's my next goal, to try to get the message of ATV safety awareness to the parents of these children. Many of them think of that ATV as strictly a farm or a ranch implement, and they don't consider that these kids aren't riding them in the same manner that they are. It's a generational issue, and it definitely needs addressing. When the ATV industry partners with youth groups, recreational agencies, local dealerships, health agencies, hospitals, teachers, and school districts, as we have, especially in our private lands state, we can make a difference. I believe that if we had more volunteers to bring this safety awareness message to the public, and if these public service announcements were brought to the specific target injury, accident injury markets, that fewer children would be injured in ATV accidents. I'd like to ask that you partner with us, perhaps aiding us with some additional sources of funding and helping me grow my program in order to train more trainers and get this safety awareness message onto the airwaves and into our highest accident injury counties in the coming year. I have 2 children of my own, both of which grew up riding ATVs, neither of whom were ever seriously injured while riding an ATV. My son, at age 16, would actually go on vacation with us and enjoy himself. ATVs are a wonderful method of getting today's children out from in front of the ubiquitous screen and outside into the fresh air and sunshine and getting physical exercise. It needs to be done safely and with proper training and supervision, just like most sports. Believe me, I've never had a kid who didn't want to ride an ATV. I hope that my comments are helpful to you, and I implore that you utilize my services as much as you are able. I will be delighted to assist you in any way possible. I did bring a number of my business cards and some of my handout materials with me, and if you'd like to see what I have available. Thank you very much for your consideration this afternoon.
Thank you, Carol, and thank you, Susan, for inviting her. Carol, I might ask, I know Mary Ann was furiously typing over here so that she could get everything down for the minutes. Do you by any chance have a copy of your comments that you could provide to her so that it would be probably helpful?
Actually, I do have, although I did pencil in some extra notes, it's basically the same information.
Okay.
I do have a website as well. I'm at www.tamu.edu/ATV.
Okay. Thank you very much. Obviously, there's not a lot of time for the committee to discuss your request right now, but I think what I'd like to do is invite you to our January 25th meeting that will be held in Fort Worth, and I can get you, if you can get us a business card, I can get you information and we'll put you on the agenda to discuss further at that time. Is that all right?
I'd love to.
Okay.
Any meetings that you have, anything like this where I can spread this message, that's what I am here for.
Okay. Do any of the committee members have
I have some questions.
Yeah.
And first I want to say thank you for the work that you do. You've obviously done a lot of research, and whether you knew it, followed quite a bit of what Paula taught us earlier. How is it that you said you go to different schools, you have school curriculum? So when you approach the schools, I know members of the audience and other injury prevention folks have difficulty actually getting into the public schools because of the curriculum that they have, the testing schedules. How is it that you convince them, and who do you go to?
Generally speaking, I go through the 4-H. All counties within the state of Texas have a county extension agent. You can find them through the TAMU website. Just go to County Texas 4-H and then County Extension Agents. Those county extension agents a lot of times will have a progressive agriculture safety day. These are generally held in rural communities. These are where the children are getting on these ATVs as used as farm implements. The Progressive Agriculture Safety Day format has been being held for about 20 years now. Any way to get to these kids is better than none at all. I don't particularly like the format because they kind of, excuse the expression, but they do herd them through like cattle. But as a general rule, I can get 20 to 30 minutes with the kids because during these safety days, they do snake safety, they do tractor safety, they do bee safety, they'll have the Rolo machine from the Texas Highway Department, you know, all that kind of stuff. It's a generalized safety message. So that's how I've been able to get my foot or wheel in the door, as the case may be, to teach these children and get my safety message out. I also do health fairs. I've worked with Texas Department of State Health Services. When they do a health fair, a lot of times they'll bring kids from the school district in that manner as well. A lot of times if I can get to a superintendent of schools who, I hate to say this, but a lot of times people search for me after an accident or an injury has happened. You know, that's okay too, but I prefer to get there
teachable
before.
moment.
Exactly. But once there's been an accident or injury, they go searching for me. And generally speaking, I find like that. So I've done school assemblies where I see from the 2nd grade to the 12th grade all in the auditorium at once.
That's excellent. Also, you mentioned that you work through Texas A&M and through your evaluation process.
Yes.
So do you have any, how long have you been doing this? How many years? And do you actually have any evaluation results?
For my program myself, no, I do not. That's why I say the only, I would hope that through those last National Institutes of Health that says that ATV accidents, although I have no quantitative information to prove that.
Yeah.
I'd like to think I had something
Okay.
to do with it. But during my safety awareness training program, where I actually train the trainers, I do have pre-questions. So before they take my training, they have to answer a set of questions that test their knowledge on ATV safety. Then after they take my training course, I have a set of post questions, and that gives me some idea of whether they're getting the message.
Right. Thank you very much.
Other questions from the committee? I have one, Carol. Have you made your information available to ATV dealers across the state so that they, when somebody is coming in to purchase an ATV for a child or whatever, ATV dealers are routinely encouraging them to go to one of your courses? Or
Yes, generally speaking, the ATV Safety Institute, who has been around since 1985, does make this information available to all dealers all over the United States. That's one of the things that I think that needs to be pressed a little bit more, that these dealers do emphasize the fact that there is this rider course available. As far as my program individually through Texas 4-H, I have presented to the Texas Motorcycle Dealers Association. They are fully aware, but not every motorcycle dealer in the state's a member of their association. So that's another reason why I think getting these public service announcements out on the TV and over the airwaves would be helpful as well.
And have you worked at all with through the legislative process trying to, you're smiling.
Yes, ma'am. I'm also the American Motorcyclists Association Community Council Director for the Texas Hill Country. I wear a lot of different hats. And in that respect, I helped create in 2006 through Texas Parks and Wildlife Department the Off-Highway Vehicle Decal Program. The Off-Highway Vehicle Decal Program actually funds me. They are a large contributor to my program. So through that OHV Decal Program, that funding is being made available through education, for this educational component. So yes, I have worked very closely with legislators.
Okay, thank you very much.
Okay, I appreciate it. Thank you very much for your time. And please call me.
Okay, we'll be getting information to you about our January 25th meeting. Hi, Brenda.
Good afternoon. I'm Brenda Putz with TTAP. I just wanted to take a moment to announce to you all that TTAP will again be having the TIPS course, TTAP Injury Prevention Symposium, scheduled for February the 25th here in Austin at St. David's Medical Office Building. We have the save the dates flyers out across the forum now, and the information for registration should hit our website in the next week or 10 days. I'd also like to say we would love the opportunity to showcase some of these programs that we're hearing about. So if any of you would like to invite anyone to showcase their programs, we'd like to share that information at that time at the TIPS Symposium.
Thanks. And did you say the save the date card is available, or?
Save the date flyers are out on the tables.
Okay.
I didn't bring any more. I think I'm running out of those, but the information's on our website now.
Okay.
And the registration will open soon.
Okay. Thank
May
you.
have some, Brenda. I'll see. I think I may have some from Mr.
Oh, your committee member, Kara, has been one of our key planners. I'd just like to throw that in. Thank you.
Other public comment from the audience? Okay, if not, I actually have a couple of announcements, and then I'll see if the committee members do as well. June 5th through the 7th, 2013, there will be a National Injury and Violence Prevention Conference in Baltimore, Maryland. It's sponsored by the Safe States Alliance, the Society for the Advancement of Violence and Injury Research, and the Centers for Disease Control. Abstracts are open, so if anybody would like to showcase their program, Abstracts are open and can be accessed at the Safe States website, which again is www.safestates.org. Abstract submission process closes on January 25th, I believe. So I would encourage you to do that. Additionally, I think there will be scholarships available. So people who are interested but can't afford to get to Baltimore, there will be some scholarships. So I would encourage you to go to the Safe States website and learn more about that. The other thing that I wanted to announce, and it's, although this is pretty far in advance, it's probably would behoove us all to start planning now, but in October of 2014, the CDC Injury Center will be hosting the next World Injury Conference. The last World Injury Conference was just held in Wellington, New Zealand in October of this year. Prior to that, it was in 2010, it was in London. So it's pretty exciting that it's going to be held in Atlanta in 2014. I think it gives people in the U.S. an opportunity that may not have the opportunities to travel internationally, the ability to travel to an international and world injury conference. Again, that information will be, as more information is available about that, we will announce it at future GTAC meetings. So wanted you to get that on the schedule. So I think that's, do any committee members have any announcements to make? Okay. Are there any suggestions from the audience in terms of agenda items for the February GTAC injury prevention meeting that you'd like for us to discuss?
Shelley. Jane Guerrero.
Oh,
over
sorry,
here.
Jane.
Sorry, I'm not part of the audience, but I don't know if you've received a letter from Jory Klein yet, but if you have not, you will be receiving one shortly. And I'd like to ask you to put this on your agenda in January.
Okay.
The Trauma Systems Committee is putting together a work group. The work group is the title of it is Trauma Systems Committee Registry Work Group. They're bringing together a group, and we'll talk about the makeup of that group. The short-term goals of this group for the Trauma Systems Committee is to foster open communication during the implementation phases of the new state registry, promote initiatives that assist with that implementation, and provide the state registry with feedback regarding desirable enhancements to the state EMS trauma registry. This group will serve as an information conduit back to their constituents and stakeholder groups regarding the status of the registry. Long-term goals for this work group are to assist with identifying data sets to be utilized in the further development, enhancement, and maturation of our state trauma system, to promote processes for data capture and validation, including the use of data collection tools for those facilities that need assistance in these areas, and to identify educational program needs to assist with the facilities with their registry development and growth. The makeup of this committee, we are asking for a single representative from each of the 10 GTAC committees. Since it's a committee selection, it will need to be part of an open meetings agenda item. Okay, so if you're going to have a meeting in January, that would be perfect.
Okay, thanks, Jane. I haven't actually received anything from Jory, and I guess my question, and I'd be glad to, I'll add that to the agenda and invite Jory to attend that meeting. Is there a deadline for responding to?
Because it has to be on an open meetings agenda,
Okay.
and it kind of missed the November agendas. We're asking that if you don't have an interim meeting before February's, that you put it on your February meeting, and that you actually take that action item and nominate someone then.
Okay.
So we're looking at having kind of a discussion conference call, I believe in December on this, and then an actual meeting of this work group probably around that February GTAC. Okay. That's the timeline as we know it today.
All right, thank you. We
Okay.
will, we'll add that to the agenda, and I will get in touch with Jory and see if she could potentially attend our January 25th meeting to talk
All right,
more
great.
about it. Thanks, Jane.
All right, thank you.
Any other suggestions? If not, then I will adjourn the Injury Prevention Committee, and we'll invite you to, anyone who is interested, to our January 25th meeting in Fort Worth. Thank you.